You ready to go?
Yeah.
All right.
Let's help start me, yeah.
Family relations will be done in Galveston.
Okay, we're ready to start now. So I call this meeting to order, May 7th, 10 a.m., the Self-Insurance Board meeting. Mr. Brown, can you give us the invitation?
Lord, we're grateful to be able to come together to determine the business of this county. Also, Lord, we seek your wisdom. We're always mindful of the fact that as we conduct the people's business here, we seek your wisdom from above. Lord, we are not here for ourselves, but we are trying to look out for others, the welfare of the recipients of this county. Help us to do those things that are best in your sight. The Lord also think of the other rather than ourselves. Be with us as we go forward the rest of this week and keep us safe. We're grateful for the sacrifice that was made for us on Calvary's cross. Bless us in your Son's name, Jesus Christ.
Okay. The next item is the agenda, but I'd like to make the motion to change the agenda without objection. I'd like to move item 5 in front of the executive session. That will allow some of these folks to get back to work soon. Without objection?
I second it. Your motion.
All right. Very good. All. Boy, words escape me today.
All in favor.
All in favor, there it is. Say aye. Aye. Right. Recognition of, so may I have an approval of the agenda now? Motion to approve?
Motion.
Second.
All in favor?
Aye.
Now we have an agenda. Recognition of the public. Whichever of y'all would like to come first.
Sure.
You can, if you'd like to stand there, you can come sit.
A couple of years ago, I came into this meeting, I guess it's when this board was first in town. As I get older, more of my friends that I used to work with are retired, and they receive the insurance that a retired person gets from the county. But they're still paying monthly via check. They have to deliver it or mail it. And we're in the 21st century now. And I was told then, a couple of years ago, that the direct deposit option was pending. But I still hear from my friends who are retired that they still have to mail a check every month. So my request stands from 2 years ago that we address that and get that going. Is there any update on that?
It's going to have to go through the trustees' account, so it'll have to go through her office. I mean, I don't know.
We don't usually have conversation during public comment, but I'll go ahead and answer. It's not on the agenda today, and the trustee's not here, but I promise you I'll follow up.
Thank you.
Because I like direct deposit. Money, printing checks cost us money, and postage costs us
Well, that's
money.
the other way they're bringing it to us, so I don't know.
They're bringing it to us.
It'll cost us
Oh,
to
you're
pay
paying, they're paying theirs.
It'll actually cost us.
They want us to
set it
pull
up.
it.
It'll cost us to set
They want
it
us to
up.
pull the money.
I didn't hear his name right.
That would, we'll have to go through the trustees.
Okay.
You state your name and address.
I am Tim Bailey. I work for the sheriff's office.
I'm sorry, I misunderstood, but I will talk to them and find out the cost.
Appreciate it.
Mike Guthrie with the Emergency Communications District and the Emergency Communications Center. And I want to speak to you about the item on your agenda that begins as the 5-year requirement. I didn't see any evidence of coverage where the 5-year requirement could be given to an employee who is also on their spouse's insurance, who is a Board of Education employee. Say previously, before July 18th of 22, an employee had to be on the county general insurance for the last 5 years of employment, and we have specifications of years to also be eligible for retiree insurance. So because I didn't see that in the evidence of coverage, I just sent an email to our benefits coordinator asking for clarification, just to ensure that did get put on the evidence of coverage. So I understand that there was some need to clarify something. I just wanted to also throw out there that if an employee is not on the county general insurance, then that employee, yes, is not paying their, what, 20%, I believe, or what, the premium. However, the county still has to afford, what, the 80% of the premium, if I'm understanding correctly, still a large portion. So if an employee is not on the county general insurance, but they're on their spouse's insurance through the Board of Education, you're not incurring that 80% with that larger cost. So it's still county money because there's funding that goes over to the Board of Education. So I just want to ensure that, one, that the employees who are on their spouse's insurance for the last 5 years on the Board of Education insurance, that when they retire, they're still eligible for county general insurance, just to clarify that. And also just to verify that the county is not on the hook for a large portion of the premiums while that employee is on their spouse's insurance as well. Does that make sense? Sort of? Yes. Okay. Thank you.
It does. It's a lot of detail, and we'll discuss it somewhat in just probably 5 minutes.
Great. Thank you.
Thank you, Mr. Guthrie. Report of the committee chairman. I have no report, so we'll move right to section 5, which is now 3. Report of the finance director.
The first one's what Mr. Guthrie was talking about, is the actual, where the board approved to add in to allow the Board of Education's, people that are on the Board of Education's insurance, if it's a spouse, to be counted toward the insurance coverage. For the last 5 years, it was not changed on the EOB because, and the verbiage is different here than at the time, it was the understanding that it would be looked at it case by case, I thought, but maybe I misunderstood. That's why we never reported. I can't swear either way, but either way, before I just added it into the EOC, since it was never added in, I was going to bring it to the committee, and also I've had a lot of questions, and we even get letters now from the state comptroller's office to make sure you guys are looking at it about the other post-employment benefits. Do you want me to go through this quickly, probably about 10 minutes, to tell you where you are at on these retiree plans?
Yes, I will.
That's one of the big concerns, and they mentioned costs. I'm not sure everybody's kind of on the same page.
I'm not sure that I got that. Yeah.
OPEB stands for Other Employment Benefits. It's OPEB, and it means if you provide something other than a pension to retired employees, we are required to put that on our audit report and disclose it because it's a future cost. It's on the accrual basis of accounting, entity-wide, and it should be, for best practices, cover during the life of the employees, but the county has not been doing that since the inception of this program, and that's why I thought it was important to make you guys aware of it before you do go ahead and focus in where you're actually at on this OPEB plan.
Yeah.
And there's been several changes. First, the OPEB plan was just wide open, and then I brought the concerns to the board several years ago, and they closed it to new participants January 1, 2018. Later, there was a request to move it to January 1, 2020, which increased your cost. And there was a request to actually count other employers' TCRS credits reported on a certain date. And then the last one was to allow Board of Education, for the last 5 years of coverage, to allow Board of Education coverage to count the same as county general coverage. But I may have misunderstood that one. I thought it was because of the way the verbiage is written, it may just need to be included that they've already been voted on. But question being, I thought it was case by case, but if you read the minutes, it looks like it was just voted on for a change. So did you guys want me to go through the OPEB, or did you just want to take the changes? Because I can do either one. Kind of show you the...
I would like to hear what we are accruing now and what we would accrue if we actually accrued to the life of the employee.
It would make a change. We'll have to send it to actuarial, and that kind of show you what we're into right now. We'll kind of give you an idea. If you look on page number 3, this plan is what you call pay-as-you-go. It means there's been no fund set back for these retirees, and I've brought that up several times. So if you look right now, the actuarial, which is about the best you're going to get, which means we actually have to hire an actuarial. They do a study every 2 years by standards and updated every year, and updated for any major changes. recording of them for services already rendered by our retirees that are eligible to this plan, not counting future services, will make more eligible. You have $9,812,880. To give you an idea about how this particular liability is changing, the estimated expense based on the employees that are retirees was $996,467. The county contributed on the pay-as-you-go, in other words, for the cost of the 80% of the employees' premiums, was only $248,001. So if you kind of shows you right there that we're contributing the actual cost as you go, there's like a $996,000 uptick basically each year right now. And I'm not going to go through the whole report because only certain pages are really.
And if I can reiterate that to make sure I'm clear, we're just hovering under $1 million per year for our county expense.
Yes, for prior credit, but if we continue
For
the project, it's
the retirees that we have.
That's for prior credit already done. It's not counting if we keep going pay as you go. I guess that's what I was going to go on for. Yeah, right now, you've already accrued $918,000 for services already rendered in the past. And then you're also accruing costs at $996,000 last year for costs that you're not funding a year, based on projected future if we leave the plan as is right now. If you look on page number 12, that's your estimated future cash outlays on this plan. And when I look at it and I've talked to the actuaries, I think it's a tiny bit heavy in the 24, 25, 26, but it's probably light in 2053, the later on years if you start reading the assumption, unless there's major changes in the healthcare industry. It's kind of a percentage.
Is this, can you tell us how many employees this is based on? And I'd like a breakdown by how many we already
Currently,
have
we
retired.
have a low number of actual participants. They're actually just receiving at this point, but several can be eligible by that particular number. And that's something I skipped because I thought you'd be more concerned on the actual gross numbers versus the.
I was just kind of wondering, with the approximate 1 million we're at right now, how many retirees we have in this bucket right now?
Right now.
Yeah, compared to how many we have coming in.
A lot. Let's see if I can find them right now.
Checking where he's at. I thought it was just ex officio.
Okay, here you go. If you go to page 25, and then we'll try to see if it has future projections. You currently have, if you look at active participants, 457 active participants and 21 retirees right now. That's how many you've got participating right now.
So 21 retirees, and we're paying almost $1 million.
No, you're paying 200 and you're
We're
paying,
paying
you're actually, the 80% is 250, but that's not the total cost. That's why we need to go on back and look. There's a explicit cost and then there's an applied cost. That's why the 5 years was originally put in there. And that's what I was going to show you. The implied cost is almost as much as you're paying in every year. And it's based on actual claims. We go back to page, I'm trying to go through this quickly. I know you've got other stuff. If you go back to page 20, go back to the one I'll show you if you already finished. If you go back to page 12, that shows you your estimated outlays until the cessation of this project. If you notice, most of the outlays are actually pushed into the future period, which means it's being passed on to the future generations. That was the big concern. That's why like when you guys got your audit letter, that's one thing they pointed out, that they encouraged the county commission to look at these OPEB costs.
They want us to recognize the accrual.
They want you to be aware of them and start planning because they're going to only get larger as we go further in the future, and I can show you why.
But they're not asking us to accrue.
No. Well, you're not required to accrue. Best practices would have been to accrue this whole time. But it's the same thing that a lot of industries done over time. They didn't accrue for, retirement and other than
Unfunded pension. Yeah.
We have funded pensions.
We do. But
We do have unfunded OPEB, though, and it's going to be an issue.
Can I clarify one point? In the EOC, it states though that at 65, we're done.
That's what we're doing right now. The only thing right now is the board approves to change the 5 years requirement requirement and allow Board of Education, which is a different plan, to be included in this one. My understanding was it was as you go, but the minutes doesn't say that, so it was never folded into the EOB, so
I
right
just
now they need to determine if
want-
they're gonna include this.
If you're new, I just want you to make sure you know that, so even if retiree, once you're eligible for Medicare, the Sumner County insurance is over.
But what happens when they do Medicare forward?
Yeah, Medicare is moving.
That hasn't been determined right now. These are based on Medicare kind of sitting flat, I've noticed too.
Okay,
If we all don't want to realize it or not, at some point they're going to have to do something with Medicare.
right, okay, so that is taken into consideration in that context, I should know. But per the EOC right now, when you become Medicare eligible, if it continues as it does, which that's an unknown, you fall off Sumner County.
Right. But you've got to think, we have people that can retire at, like me, I'll be eligible 52.
Right.
And what's Medicare?
Yes, I know you've got early, I know there's early.
What's the Medicare, age right now?
Well, it depends
Well,
on your
65 still,
I
isn't
think
it?
it's 67 in it, is it?
Well, 67 for, because I already did this. 67 for full retirement without penalty to work or anything like that. You get your benefits. 70, it depends on what year you were born, but 70 is where you can get full, like your full amount. But 67 is like, for example, if I retired at 65, I get penalized.
But that's for disability, so
No.
They've changed it around a lot of this.
The Medicare amount you get,
okay, yes. But you are eligible for Medicare.
you are,
Still at
but you still get
65.
penalized.
Yes, right, yeah, there will be a penalty, but your EOC right now, today, still says Medicare eligible.
So
It doesn't say anything about
That's
penalization.
13 years.
Right, so just FYI, I just want to make sure we understand, the EOC is what the plan follows, so if that needs to be clarified, today's the day to clarify that.
Does
It's not going to be a lot more cost if we don't.
the employee get to choose? Or is it they're eligible, they have to go to Medicare?
I mean, in the EOC right now, it says,
Page 4 shows.
it says. when
These
you're eligible for
calculations are
Medicare.
based verbatim on the EOC, so if the EOC says eligible, that's when they cut them off, that's why it's cut off.
Yeah.
If we change those, that would be considerable cost. We're talking probably $1 million.
I understand, I was just want clarification on.
But when we're talking about, if you look back on page 3, and you're talking about the 248, if we look back on page 21, it can kind of give you a better idea. If you look first, it says explicit subsidy, okay? So basically, you guys, for this past year, agreed to cover 75% of the retiree, which is $630.99. But the reason the amount of coverage required to be under the county plan, if you go to page 22, there's a thing called an implicit or implied subsidy. Basically, what they're saying is that your average per capita retiree is almost $1,800. The premium you're charging for the mixed plan is only $841, so you are really subsidizing for additional $950. And then if you look over at a spouse, which they've always said, that's something I've tried to make sure everybody understood, they've always said your spouse can continue on, but the county won't pay anything toward it. Yes, you're paying things toward it, because the spouse, when you take all the claims together, they're on average $1,625, and the full premium is $875. So if you go through and you add in the explicit and the implicit cost, then the county is contributing quite a bit of money. Because it goes right here, if you look on page 22, it goes retiree and spouse. The retiree in 23 would have contributed $210.33. A spouse, if they stayed in, would have contributed $875.24. The cost of those on average is that bottom number, $1,791 and $1,625. So you're implicitly, whether you realize it or not, subsidizing those quite heavily, including spouses. That's been going on for a while. So there's the discussion of the cost, but it's not as clear as it looks because you're doing a cost pool. And the thing is, the reason for the things on the cost pool is to make sure there's enough money pooled. And the school cost pool really has nothing to do with the county cost pool. They may have taxes, but they have nothing to do with each other. And then here's another one why I think you've got a concern that you really need to look at. If you look on page 25, it's your demographics, and this has been a continuing. The average age right now is 44.9. In 21, 2 years later, it's 45.8, and that's been a continuing trend. The county by and large has had a increasing increasing age on the average. So if you have an increasing age, that's another concern. Then page 27 just breaks that 9.8 between general and highway. But mine is, based on the minutes, the 5 minutes should be included back on the EOC, but before I contacted Blue Cross and Blue Shield, had them to include that in, I wanted to make sure the committee was aware of the ramifications of all the changes. And I think we had a similar discussion when they made the original change.
Do we have an employee that's, retiring right now, that's on the,
I don't know, I just know the one in the minutes, it's probably made us 5 years, it didn't really affect, I don't know if it affected that one. They were on the plan afterwards.
if we were to move this to old business to give me more time to absorb, because it's more than, what they, I understand that we're discussing, the changes that were made a couple of years ago. There's a few more things in here I'd like to kind of go through and do it all at once, unless there's somebody that's waiting for
let me
the
just-
formula update.
Just ask one question, if we have a retiree come in during the month, since the minutes currently conflict with the explanation of benefits, do you want us to go with the minutes? Because the minutes, if I read them, it should be added in the explanation of benefits.
I would.
We had a different understanding at the time, that's why it wasn't folded in, but when we were asked about it, I'll go back and read the minutes. The way the minutes read, it was basically counted, they could count for the whole full 5 years of service for the employee.
Mr. Law Director, it's in our minutes that we said we were gonna do it. I would tend to think that we would do it, even though we didn't.
What is it we're operating with in the contrary?
Nobody's brought anything, and it's not been brought to our attention before, we've not had anybody's come.
So the only guidance we have is the minutes.
And maybe kind of my point is, I think we should follow the minutes right now.
Yeah.
I think we should follow the minutes, which means the last 5 years could be all Board of Education
At
service.
this point, yes.
And leave the EOB until final decision.
Yeah, give me some time to,
Just to be clear, nothing's been ratified other than what you all gleaned from the minutes, correct?
Yes.
Then
Everything's
yes.
into the EOB or
The minutes are gonna steer
the
this.
actuals.
Yeah, okay.
but this whole topic has a lot of depth to it, I'd like to come back to.
And the only reason I bring it to detail, it's been recommended by audit and everybody, for somebody to look at this, and this is probably where it needs to start. Right now, there's a large liability that's growing. The county and schools have one, schools are even larger.
So I do have a couple of, side items, and I know we have a lot on our plate today to do. The school, is their retirement benefit the same?
You mean their TCRS?
No, I'm sorry, their coverage here.
It will be in the audit report, and I can't recall off the top of my head what they're doing exactly. But everything on actuarial or the important stuff is actually on the audit report that's online, and then so is the schools.
Okay.
To be perfectly clear with you, in addition to this one, and I believe it was closed back in 15, the county, if you were hired before, I believe it was maybe 2015, there's a Medicare supplement that the county has that has about $1 million, I think it's around $1 million liabilities in it, or maybe two. It's unfunded also. It's done through TCRS. So the OPEB thing has been a big thing over the last several years. It's probably 2011, 10. It's been a big discussion.
I don't believe we need to vote on, leaving things as they are, they're in the minutes.
I'll just go by the minutes.
Go by the minutes, and then, I motion to move this to old business,
The entire thing or just sections?
this section on the, on discussing the, health insurance for retirees. Can I get a second on that?
Second.
Any discussion?
You guys may want to also move this forward to budget for them to look at
I
it.
will.
The way they can discuss potentially funding as you go, or funding mechanisms, or some curtailment mechanism.
Yes,
But
that's
even
what I
with
want.
the curtailment that's in there right now, you're still looking at millions upon millions of future dollars for somebody.
If you could, in follow-up to this, get us a cost for the actuary.
For this, we do one every year.
We do it, so we got it. Okay.
We're updating it for 2024 right now. We do it every year. It's in your audit report. But you know, the audit report's that thick, and then they even put it in a letter they send to commissioners and everybody, but I'm not sure everybody's really thinking about how much is being passed.
Yeah, I'd like to have some time.
So we
All in
voted.
favor of moving it to old business?
Aye.
Good. move on.
And
We
then
vote to forward it to budget too.
motion to move to budget?
No, not at this time. Let's discuss it more. I just want more time to think about it before we move it. All we're gonna do is move it to budget, and I'll have to think about it there. So, I'd just rather hold it here for the moment. They have enough on their
Does
plate.
it affect anything that's going on in budget now?
The only thing it's gonna affect is we're paying as you go, so they're gonna continue to pay as you go. If you make a decision in here about that file's permanent, we'll just report it to audit, and it'll show up increasing the liabilities, maybe not even.
So if we pushed it on to budget now, we'll just have to deal with it and go ahead and make it.
It's really just gonna be discussing how big the liability is and what you wanna do long-term or if anything. Because you could start funding, but you'd have to come up with money as you go, and you'd have to backfill a lot of liability. Or the only other option is a curtailment, and the same thing, there's been questions about that since all these promised benefits or not. And it used to be in the EOB for many years that it was based on annual funding, but I think that may have been removed. I have to go back and check, because there's been a lot of stuff changed over the years, the committee. So the question is, if they remove that language, is it really a promise?
My only concern was that not getting this on budget isn't gonna affect what we're trying to accomplish before the next fiscal.
You know, we put amounts back for retirees at our best estimate anyway.
Okay.
Or pay as you go.
So it's your call. How are we doing
Yeah,
that?
well,
You're doing pay as you go. If you look under the budget, under employee benefits, there's an amount down there for it.
here
It's about
we go.
200 and.
Even if it-
Technically, you've got a motion, so.
Yeah, and if it, we discussed before in finance, and it needs to go to budget, it can go straight to budget without our motion to move it.
Yeah, Sheriff can put it directly in
Yeah,
budget
just put it
anyway.
right on there, so
It may be something they want to do after the budget's approved this year, but right now everything's kind of.
it's kind of, yeah.
So you'll either need to withdraw your motion or get it seconded and move on.
My motion was to move it to budget,
Right.
Can I
So-
like a second?
and
Oh, we can move it there.
No, all I'm saying is we need to clear up this motion. Either it dies for lack of a second, it gets seconded, we just need to move through the process, or she withdraws it.
I'll second it, let's move it on to budget. What did I hear last night? It's still gonna be my work to do. So,
It's whatever you want to do, the formalities is all.
okay, I'll second it, let's move it to budget.
Got to vote.
All in favor? Aye.
For clarification, it won't be there in June because the May's agenda's already set upstairs. That's the deadline, so it'll be June.
Thank you.
Item 2 under my report is a request to actually look at the EMA insurance. I don't think Mr. Widener's here, but he did send us the full insurance, and we did send it to him the other day to ask her if she could look at it, and I don't know if she got anything back or. I'll let you determine if we could self-insure or what the.
Could you, discuss, the item that we're, reviewing?
The county by and large is self-insured except for they buy reinsurance on buildings and liability. This particular department here has been buying full insurance on equipment, so the question came up, and they've also been buying, I think, liability workers' comp type insurance on volunteers. The question was, why were we doing both? Mr. Widener said that his understanding is that we have to insure the county's equipment. We can't be self-insured in order to insure those volunteers, and I think that's the question that came about. Is that with just his particular vendor, or is that in period? And is it more cost, I think the question you guys posed to me, is it more cost efficient to self-insure like everybody else, or just insure his department only, so there's been a lot of questions of why his department's insured.
So, Ms. White, can you tell us, this is the policy, What is this, does this policy cover, equipment? Does it cover, volunteers? What does it cover?
It covers everything that currently we have policies for, except for the volunteers. Risk management has never covered volunteers, or for anything, because there's no salary. So we have never addressed covering a volunteer. Oh, and everything else that we have that he's listed, we have cyber insurance, we have crime insurance, we have property insurance, but he's also got them at a extremely lower deductible than what we have. Our current deductible is $25,000. He stated before that if he were to have a loss, it wouldn't cover, because the deductible is so high, nothing that he would lose would be covered, because the loss would not meet the $25,000 deductible. So, and then he has his automobiles also covered, where we do not have, we're self-insured for all of those items.
Why do we self-insure our automobiles?
Saves us money.
Yeah.
It saves us money.
Self-insurance by and large in the long run saves us a lot of money. Just like this one, the big question is, can you be self-insured and then insure those volunteers separately? Because I don't think you would want to self-insure volunteers, but if you made the equipment, you may want to self-insure the equipment.
So I've been looking at the equipment listing, and there's quite a bit of equipment at EMA. Does this policy cover all of that equipment?
His policy?
Mm-hmm.
Yes.
I've got a bunch of problems, questions about this. One is, there's no auditing, there's no trail. I don't know when there's an accident, I don't know when the county's susceptible to a lawsuit. I don't know anything about what's going on over there. These volunteers, if they get injured, I don't know what's going on with these volunteers. And what are they volunteers of? Who screens them? Are they volunteers? Could they be also part-time employees with the volunteer fire department? I know nothing about any of this. So this is a lawsuit waiting to slap me in the face.
You also didn't review these insurance, because
Right.
I've inquired about because you got a policy and it's over the dollar threshold, they should have been reviewed by legal, and I can't find a review for them right now.
And we get into some of the coverage. If I'm not mistaken, an appropriation was done by EMA for a drone that was damaged, and it was to the tune of $4,000 or $5,000, I believe. When I'm going through this policy, I think their unmanned aerial vehicles are covered in their policy. So was it a claim and a appropriation?
Yes, they're doing their
So,
own appropriations.
I don't know. There's no accountability. I don't know if training needs to be implemented because repeat events are occurring, much like we have a driving policy with the different departments. So, other than the fact I saw the policy yesterday, and I didn't even get the chance to go through the whole thing. Self-insured and insured at the same time. I just don't get any of this.
Well, it's never been reviewed by legal, it's kind of a policy issue. And then the other question is, do you guys want a policy about insurance? Because it brings up a really good question. If EMA can go buy their own insurance, what about if highway or some other departments come in and say they want to start buying their own insurance because it's deductible? I mean, it may be one that the policy of reviewing this thing wasn't reviewed by policy anyway, but the question is, do you guys want to allow other departments to buy insurance?
I think in the past, by including it in budget and rolling it through with approval on budget, the commission did approve it, and perhaps they just didn't look in the weeds to see what they were.
They appropriated for it.
Yeah, they appropriated for it. So,
But I don't know if you guys have a policy/resolution, and you may need a policy ratified by the county commission of who and what insurance can be purchased by these departments. And then how and the other questions like what's covered under the OJI, can you cover additional, all those questions too. There's a lot of questions that's never been answered out here.
Have we been sent a copy of those fully insured volunteer policies to review?
It's right here, that's when we asked for the full copy of it. We inquired on legal if it had ever been reviewed, so they said no, so we had to get it from Mr. Widener. We got it from Ken, didn't we, directly?
But have we been sent a copy with a request to review what you're discussing?
No, it's in the agenda today.
Okay, volunteer insurance is a different animal. Sometimes these policies it's really difficult for a volunteer organization to purchase insurance on just liability because of control, management control. That's what it gets down to. So they want to make sure that it's more of a fully insured model to where they're insuring that entire volunteer operation. And when they get mixed in with everything else, that's where the lawsuits authority to mandate to an insurance company what their policy covers and does not cover. None. So you can go to court and argue it, you know, that we believe it is covered and you're saying it's not. That's gonna happen sometimes. But I think, yeah, we would like to take a look at the coverage document, which is the contract, and see where these possible things might exist between that and your self-insured program. When you drag in, not drag in, but when you slide OJI into that mix, as far as work comp or occupational injury, now we have another discussion, okay? Because OJI is not technically ruled by the work comp manual, although I think you all pretty much use that manual as your guidelines. You are not obligated to, because you have opted out of work comp. So, and we have encouraged the county for some time to take a fresh look at your OJI program. We will insert that again as something. It would be a separate study, but we've done those for Montgomery County, Rutherford County, several of your neighbors. And just to make sure it's doing what you intended to do and that you have coverages and liabilities placed in the right place and properly funded. So we're here and we should do whatever you need us to do.
Can you tell me where you think that the county is falling short in the OJI program?
I don't know that you're not, as far as that terminology, you're not.
Okay.
I think you're doing the right thing with OJI. It's how you manage it, how you structure it. For instance, and I've said this before, so this is not new. The work comp manual is about the size of this laptop, and it gets updated quite often because it's a government document, and you have to keep up with those things. These are estimates because they change. I think Montgomery County, their OJI documents around 18 pages. I mean, this is a whole other discussion, so I don't want to take up your valuable time today to do that. But in managing that program, and managing the legal costs on OJI and those kinds of things, those pockets can be cost effective or they can cost depending on how they're structured and how you do them and so forth. I don't know that good or bad. What I'm saying is you all have to look at that program specifically. To my knowledge, there's no real in-depth.
It's been back in the middle 2000, 2007, 1999 is when we actually went OJI.
Yes. It's a pretty in-depth study, that we've done before successfully, and we have no doubt that we can do it again. We'll be open to discussion about that.
So what will be the cost of that?
We have to look, yeah, we give you a formal proposal.
I propose that we have, the finance office discuss, what that would look like for us if we wanted to do a study, the cost and benefit of it.
Of what, the OJI?
Yes, the study that
We just gonna hire somebody to look at it, or
Bob can do it.
Bob can give us a quote?
Well, he'll work with you and see what we,
We need to look
they
at
need to look at it
some
before.
aspects of that, see what kind of time and so forth.
Probably do it after we get the budget.
Yeah. At some point, if you could bring it back in our next meeting.
Well, we got budget in year end, I mean, that budget's gonna tie us up. So I said if we could do it after budget year end, that's probably a good time to start studying.
September,
Start studying in September.
it's been this way forever.
It will be pretty,
All right,
Mark
so
Verde.
if you could put that on your calendar, to do for
for the month of September.
the month of September.
To give us some time, do we have permission to go ahead and request what information we would need now? Or do we have to wait until it's,
Go ahead and start trying to send you stuff.
that way we can have enough, we won't be rushed to do that.
And then we can start working on your questions and emails too, so things you're gonna run into.
Parkland is online.
Right,
Risk
there's
management.
ancillary costs that we would need to also.
They all need the financials and your claims.
Just send an email with what y'all want, we'll try to start getting it to
And
you.
Kim has access to the financials too through Munis, so you might want to get all up through Kim. And plus you got your other software too.
All right, so y'all are set. If we could go back to the, topic at hand of our outside insurance policy. We've given you a copy. Legal's gonna look at this.
You talking about PMA?
The EMA, I'm
Yeah.
sorry, yeah, the EMA. But right now, where we're at in budget is we're looking at a request for $40,000 to continue this outside policy. We can have discussion on that. What's the rule of
Motion.
body? What do you want to do?
Motion to discuss.
All in favor? Aye.
So my question is, they're wanting $40,000 to continue it. When are they needing to be renewed? What's the renewal date on it?
Without a
It's the July
budget,
15th.
without a budget approval, they won't be able to pay it. It has to be.
If it's a July 15th date, my thought is you may want to at least continue it until you have a chance to study it. Because you probably don't want to remove coverage if you're
Yeah,
not sure of the.
I would not recommend doing that.
Time to study.
We need some overlap here, regardless of what you all decide to do.
You don't ever want it to lapse.
With it ending in July 15th, it's going to be really pressed for you guys to get enough information by, this is what, May, what is it,
None of their.
That's a month and 8 days.
Showers or anything is on our schedule. None of their equipment is on our schedule currently.
And it could be that it,
It has to be scheduled and figured out by these volunteers. That's the big concern is volunteers. Because if I understand from Mr. Widener, we had to cover equipment to cover his volunteers. Is that this one or all of them? Bob, the way Bob's talking, it may be all of them, so it may not be a choice. So you may have to, if you're going to self-insure that stuff, you may have to self-insure these volunteers. I don't know if you want to do that or not.
I'm looking, this is scattered, but the top page is the package policy is $12,056, and then I see an auto policy at $18,510. I guess that, is that what we're coming up with for?
Yeah, there's several, but he's saying you've got to have both. Ken, they told Ken, what he's told me, that they have to have both to ensure the, volunteers. In other words, you have to insure the equipment and all that to insure the volunteers is what he's told us. So that's the question, kind of what you alluded to earlier, Bob, that's probably all insurers, not just his, the way you kind of, so it may be that you have to insure volunteers, self-insure them if you're gonna pull out the other, which is something you really want to study before you do that anyway. You probably want to study to see how much risk you're taking on for getting, if you self-insure the volunteers.
there's a lot of equipment, if that's all.
Now, my thought is if they're self-insuring the volunteers, and we've done it all these years for this amount, and they're making money, we don't have a lot of claims, so it may be a good thing to self-insure, but you're still going to want to study the claims history and the risk, and if tort liability falls back in, I'm assuming on the volunteers for us, and all that good stuff.
And can we bring this back in and manage it, in risk management?
The other question is,
The, appropriation committee?
kind of like Bob's question, I'm not sure OJI workers' comp, what you're really insuring on volunteers. Are you insuring them for their regular working job, or?
Well, if you don't have a separate plan document for OJI, it specifically says, what we were talking about in medical a moment ago, if that document doesn't say that they're covered and how they're covered, it's gonna fall back to whatever the work comp regulations are, which you're not under, but you've been using them as precedent.
So what happens to
For paying
volunteers?
claims.
So what happens to volunteers?
If you have been paying claims on volunteers,
We have not anyway.
we don't have to worry about that if the volunteer pops
Hi,
up.
I'm
says,
reading
"Well, you
out.
paid it for old
Get
John,
started.
why aren't you
Download the
paying it for
Meeting
me?"
Now app on your phone.
You're, as long as that precedent has been in place and not violated, you just need to make it a part of your OJI document.
But you got the other issue here, if you have been buying a policy that would cover these volunteers and Ken have been telling them that, and you suddenly say, we're not gonna cover you as a volunteer, you're out here going through the woods or whatever, you may not get any volunteers. $4,000 may, in reality, be necessary to get volunteers for EMA. It may create another whole issue. That's why I'm saying it needs to be studied, because it may create a few other issues getting rid of it.
Comes down to management. Who's managing the volunteers, what control you have, what training you start, as opposed to employees and so forth. So,
Even if that's a good policy, to me, it seems the bigger distinction is to separate out these things and decide what needs to come under the county, and if the volunteer thing needs to be separately insured, it can, and then we're talking about a very insignificant policy at that time.
exactly. But this point still exists, and I'm looking at the form of this policy, ISO and so forth. It's, they run into, we're not gonna sell you this policy on your liability. We need other products to make a profit on it. But liability, a lot of times, is not profitable, because you don't know what your risk is. So you get into a claim in court. If you're insured auto, you know, you can digest that, you know what the maximum loss is. So they want some of that premium where they can estimate their losses compared to the liability that they can, and the liability is not as good because most of the time volunteers are not as managed as others or trained and so forth. And in the absence of a risk manager, that also complicates the insurance look at their liability and exposure, because there's not constant training, someone there to evaluate risk, evaluate claims that happen, have meetings with employees to go over claims that have happened to prevent them from happening again, proper wearing the right equipment, and on and on and on, because we sit in these loss control meetings all the time. There's a lot there.
Wouldn't best practices be for any insurance to go through the risk management office? That way we can coordinate and make sure of coverage. Just from a financial and management and best practices policy, even if you keep the policy, I would think it would probably all need to go through risk management, where it can make sure it's not double covered, not covered enough, or missing holes right now, because we're not sure.
Well, just for simple audit.
And through legal too. Yeah, that's why I think it should go through legal and risk management just to determine for best practices. So I think that may be something to look at the policy of, the insurance has to go through risk management at least, because right now Bob's not looked at it, legal's not looked at it, we don't know what things are being, right now you're telling us things aren't being covered twice, we know because the towers aren't on there. But in there's got a good question, there's a $4,000 drawing appropriation, but if we look at the deductibles, they're much lower on this, so what was the, we don't know. And you guys don't know because it's not running through the board.
One of the items that I see right now, as far as we look at this request for appropriation, I don't think we can approve it until you at least review the contract. So I'm wondering if you can commit to at least in budget a review of this contract before we meet on the 16th.
Which contract are you looking at?
This is the extra insurance that we're talking about from EMA.
Yeah, you may want to correct the appropriation over into risk management major category anyway, put it under their control. Well, they can, if you take the same 40 and move it over to risk management, then you'll have the review, because this should go through legal. And, you have in the general fund, we have where we pay all the reinsurances, move it over into there versus EMA, and it would make it.
And then a step further out, if we keep this type of separate insurance, is this a professional contract or a biddable service?
It's not. The 25,000 is your bid limit. This is what, one's 12 and one's 18. Really, they should be bid every, I think it's 3 years. So really the question is, I think he did bid this one. I'm going to have to go back and look.
Okay, can you check that?
Yeah, can you write a note about that? Can you go back and ask him for what he's been bidding that, or where we've been bidding it? Or if it's been ranked as a
So
professional.
do we need to make a motion that, this needs to be put through risk management so they can review it, and then it goes legal, and then that is all reviewed, and then decision is made? I'm just trying to get.
It'll need to go from there to budget to create the line, and then I guess the commission would ratify.
I think it'd be a request from this committee for budget to appropriate all that insurance from EMA over into risk management, put it under the control of risk management and the board.
Right.
Determine if it's adequately covered and correctly.
So that would be the motion to do that. So I motion that, that's what he said. Can't articulate that much, it's a mouthful.
All in favor? Yes. Aye. So just to reiterate, it's gonna go through risk management now, we're gonna move the line item into your department. And we're asking legal to, give us an opinion on this contract before the 16th. And just report back to this committee, but it's gonna go, budget already has it on their agenda.
The 16th.
We have not approved the EMA.
Okay,
Your appropriation, if you could report to both entities, both this committee and budget committee, about this, if this is your recommendation of it.
so just to be clear, the motion you all just approved was, you just simply said what he said, and he said to move this to budget.
On the 16th, for them to look at it, basically put it under the control of risk management, move the appropriation to risk management, the way it can be adequately reviewed for proper coverage and to make sure there's not over coverage or lack of coverage.
And to clarify, that includes the checks coming back in will go to risk management. If we have a vehicle claim and the insurance company was to pay, they'll pay into risk management. Is this what we're all, are y'all with this? Or? Instead of the.
Basically, they'll process it versus the amount.
Yes, exactly.
Like you do on the other.
Yeah, you want me to manage their claims, basically. That's what
Yes.
you're saying.
Their full insured client.
That's what I'm saying.
Yeah. So they'll just have to start reporting things to me.
That would be the control party.
Probably just make that as a motion.
Okay, so I'll make a motion that the processing of claims go through our risk management department.
For EMA.
For EMA, for this, if we go forward with this insurance policy. Can I have a second?
Second.
All in favor?
Aye.
Passes unanimously.
That's into my report.
There is one more thing. I'd like to make a motion that we ask, the legislative committee to bring forth a policy regarding outside insurance and take it under study if we want to, allow other departments to have insurance or how we're gonna handle this in the future. Ask legislative to take that under.
I move on that.
Second? Bob, give me a second.
No, well, I said I move on that.
He
I'll
moved.
second. Okay, I'll second. All in favor?
Aye.
Passes unanimous. And we look forward to your comments back on that. All right, that ends the report of the financial director. We move to the report of the consultant.
All right, so, let me get this
Want
first.
to do the executive first?
Quickly, this is just our monthly report, this is not come.
Terry missed the executive session.
Oh,
You want to do it after?
can we do it after so that they can go? Is that okay with you?
Yeah, that's fine.
That's what, I'm sorry, I didn't move it, I did think it in my head.
I'm here till you tell me to leave.
Thank you.
Here we go. So this is the monthly report. I did send it via email to Amy, so I don't know if everybody can have it. You can see it electronically as well, so we do keep this. I do run it electronically as well. So, okay. So again, we've had another good month. I do believe a rebate check was received on RX this month, so that always helps. That's why the monthly change was so positive. For the month of April, remember we're looking at last month, even though we're in the month of May. So, looking at year-to-date for the Health and RX fund right now, that change is very positive at 2.2 million, so that is very, very good. Looking at dental, we are still running positive. That's been pretty good. In years past, we've had months that have been negative. So far, we've been pretty positive, pretty good there. So that fund is also looking very good. On large losses, one of the this happens sometimes. Someone just crested the 100,000 mark. They fell off of that report. They went under the 100,000, but they were replaced with someone else. So if you ever happen to like line up my reports, and you might see someone that turned and now they're not. That's why I can always go in and give you a patient-to-patient comparison with no names, but just know that someone had fallen off from last month, but another one came on. I'm not super concerned about anyone. The largest one that continues to creep up every month is the same one I talk about every month. It is medication. It's about $20,000 or more, a little bit every month. It's a critical illness. It is expected. I don't think that this person will hit 500. If they do hit 500,000, which is my marker to reach into this running county stop-loss fund, it's down here at the bottom. It's right now at 1 million. I'll take that extra money out of that fund because that's our county stop-loss fund that we kind of call our own stop-loss that you all are paying into. So again, we're still doing pretty well. You do have 2 folks that have terms, which means they have fallen off of the plan for various reasons. And again, this box here at the very bottom right with the PEPM, which is the per employee per month, which is, to me, one of the most important numbers of any plan, because you can grow and you can also shrink in size, but what does it cost to have an employee on the plan? So for this plan year, you all are getting very close to what you were around the 2021 plan year. So that's very positive in my eyes. That's a very good thing. Most plans are just tracking sky high, always growing, always more expensive, always increases. So things are doing pretty well for the year. Were you going to ask this question? I saw that.
Yes.
Okay, yes.
We have 2 new commissioners that have joined us.
Yes.
Could you just briefly explain to them how we come about with the stop loss?
Yes. So on the so for the large losses, the way that I get a report from Blue Cross Blue Shield every month. I ask them for just a large loss report. What that means is anyone who's, I think their report runs about, I think when someone costs over $25,000 in claims, I don't put them on this report till they're over $100,000 in claims. So that person, since July of 23, has accrued over $100,000 in claims. That can happen kind of easily if you've had something pretty big happen, heart surgery. Usually the things that get really, really big are chronic illnesses, so drugs, medications, specialty medications, cancer cases like chemotherapy, things like that can be very expensive. We also often will see, and the reason that I don't lose sleep over some of these folks is because if they've just been diagnosed with something, that first year of a diagnosis can be very expensive because you're having your initial surgeries, your initial treatments, and then it chills out after that. Or it might be that you have a couple of years that are very expensive and then it kind of calms down again. So that's why we keep an eye on it. But then in July, well, actually it'll be the August. In August, if we have this August meeting, whatever, I'll start over again with our July numbers. So every single year, we treat it as if we have our own stop-loss policy. Stop-loss reimburses you at a certain point. You were paying Blue Cross for a stop-loss policy for many years. $500,000. Anyone who went over $500,000. So you were paying for an insurance policy that you were never getting money back for because you didn't have people going over $500,000. Since you've done that, what you all did instead, the trust decided to pay yourself for stop loss. So every year I have Blue Cross run some quotes, and I figure that in, and I let David know how much that costs, and I put that into this running county stop loss fund, and that's how much you all are paying yourselves this year. And if you would have had stop loss, or if you've been paying yourselves this million, since you've been paying yourself, sorry, that's not just 1 year, but since you've been paying yourselves, you paid yourselves $1 million, and I think only one time you took a little bit out. Maybe it was under $100,000. It may have been like $50,000. That's how much. So it was worth the decision. We do look at it constantly, though. That is not something that is set in stone that we can never go back on. We can always purchase stop loss if we need to. So.
And I can interject. I don't think that I explained
how our consultants work. When she says she doesn't lose sleep, that's what we hire her for, is to manage our trust and to lose sleep.
Yes.
But we don't have to. So
I will, and I don't sell anything, that's also
Yeah, they
important.
don't sell.
I don't sell insurance, so when I bring you a product or something, like, I'm very agnostic to the groups that you choose, the insurance companies, that kind of stuff, it doesn't bother me.
May I ask what the name of your consulting group is?
It's called ESP, or Employee Security Planning. So I deal with people with feelings, and then Jeremy, who's sitting behind our one-to-one clinic folks, he, it's RAI, he also functions CSP, but they do buildings. No feelings, no people, buildings. So they do replacement costs and buildings, things like that, so you'll see us quite a bit. So we're here for just insurance things that don't need to dig in. Are there any questions about that report?
That's just your change for the year, that's not your
Yes.
total reserves in the health.
Correct. I don't report on reserves. If you want reserve numbers, David is the guy.
And I can tell you, at the end of 2024, your total reserves in your, well, that's an estimate. See, actual at the end of 2023, you had about 16.8 million in reserves total. We're estimating you're going to have about 17.7 million in reserve totals at the end of this fiscal year, or estimating that you'll be pretty level next year. But that's a conservative estimate, so you'll probably gain.
And reserves are not for us to build buildings or to buy trucks or do any of that with. They are in case there was some type of mass event that were to happen, if there was some type of major issue that occurred. Or if you were to stop being self-funded and was fully insured, there will be claims that continue to come in year over year. So that, you do need to have reserves. I just want that to be very clear. That does not mean we get to go shopping.
And you couldn't take them out anyway, because they're 80-20, so there's 20% employee money in there. So if you started removing money from the VERS, there's a lot of legal questions that may arise from that. So yeah, it's really restricted in for health insurance.
Is there a base that we have to keep in there always?
I would recommend that you try to keep the thing relatively flat. That's my thing, let it just keep growing, because you don't know what's going to happen with all the changes. Several years, when I came in here several years back, we had major issues. It was a deficit that they knew about. And then there was my first week, was it?
Yeah.
There was a discussion that schools were going out and we were going to receive all this money. Well, their discussion went the other way. And when I looked on the books, I couldn't find the prepayments, so it ended up being much worse, and then it just continued downhill. And ultimately, they did the wellness plan, everything got back in shape, but I would recommend you try to keep it flat. It's your goal always. And if you're conservatively keeping it flat, most of the time you're going to grow unless something really weird happens.
Right.
But you need a very large reserve.
Yes, so there's usually you want to also keep around, I think about 13% is usually what most actuaries would want you to. 13% of a yearly spend. That's the base minimum. Most people would like at least an annual cost in a reserve. Everybody's finance director actually will tell you something a little bit different. Yeah, some people.
I would say higher than that, because a couple of years back, they removed claim limits. So you have unlimited claims on every single employee. So if you have premature birth that's $2 million,
yep, and that can happen.
You got it all.
That's a reality.
This committee took off claim limits.
No, you did not. It was done by the Affordable Care Act.
Okay.
So it was removed, and we quit reinsuring it, because the next $1 million, if you're unlimited, is not really going to affect you. You never had drove into it, so it wasn't really being cost effective. That wasn't a change this committee chose, because that would be a very unwise change.
I just wanted to clarify that. I thought it would be on.
It was a forced change through, I think it was the Affordable Care Act was the one.
Also, if there were claim limits, what would happen if I was an employee and I had that $2 million baby, and if you had a claim limit and you would only pay $1 million for that baby, the collectors would then come for me. So that's not a good look for the county either. If you've got an employee who's then being chased by collectors because of an unfortunate health circumstance, that also doesn't look super great. So it's not a great recruiting tool. So I like to kind of give that realistic look at things as well. So you're doing super well now, but it's because you make really good decisions and you're cautious and not just quickly just moving around all over the place. So, yeah. That's it for that. Yes.
wanna, and I know it's under old business, but did you wanna do the NLQ before or after one-to-one? Cause they're here just to talk about the insurance.
Yeah, that's what I was,
You're under old business.
Yeah.
below.
Well, you're under there as insurance coverage one-to-one. Oh.
I'm fine, they can come first.
Yeah,
You're-
because
you
we
wanna do
have a bit of talking to do.
Did you wanna firm up the X-ray machine coverage and the other equipment when it goes into effect?
Yes, we do wanna talk about it, so it's just a matter if we wanna move them up and talk about it so that they don't have to sit through all of it.
That's your call.
Yeah, I appreciate the recommendation. If I could get a motion to move up one-to-one above the, NQQL analysis so that they can get back to work.
So then,
All in favor?
Aye.
The floor is yours. We have some questions regarding one-to-one, but do you have a report this month? No.
No, I'm sorry, we were under the impression we were just here in case you guys asked questions about the coverage policy.
that's what I understood too. I didn't think they were
That's
gonna
fine,
get it.
that's fine. It's just I'm so used to hearing it.
We didn't ask them for one, cause we just thought you wanted for the coverage.
No,
'cause
that's okay. We pretty much stated all of our rules. I'll open it up for discussion regarding the one-to-one equipment. Second. What we have some questions on
You don't need to suspend the rules.
I know, I should we kind of, okay, I'll make a motion to suspend the rules.
Second.
All in favor?
Aye.
Aye. We kind of did already. So, if someone else would like to discuss this topic.
So what is one-to-one
Oh,
do? So,
I am so sorry, yes, could you give us a briefing of one-to-one and cover for us, the number of clinics, and we have prior reports of locations, and give us just an approximation of employees that you see monthly.
Okay, perfect. So we are the on-site, near-site employee health center vendor. So we staff and provide services for the 5 clinics across the county. So there's Portland, White House, Westmoreland, and then a clinic in Gallatin at Chaser Middle School, and a clinic in Hendersonville at Ellis Middle School. Counts vary by month. I will give you accurate information and not make something up. But we manage the wellness program for the employees, so they have to either participate in the physical or biometric screening event yearly, and then participate in health coaching depending on those outcomes. We manage that program. And then all the other services done through the clinics, we manage that, including the mail order program that we implemented last year. And last meeting we reported on that, but essentially it saves the county almost $30,000 in shifting some drugs to mail order through the clinics versus going through your normal pharmacy benefit.
When you say plus all those other benefits, could you fill in a few of those, like some of the benefits that we all, that if an employee walks in, what could they say I need done?
Yeah, so we're obviously a lot like primary care for most of the employees, so they see us for most all of their healthcare needs. We do annual well woman visits inside the clinic, so you don't have to go to a gynecologist for those unless there's some other issues we refer you out for. 24/7 availability through text care, so you literally just text the clinic phone number, and 24/7, middle of the night, holiday, weekend, somebody is on staff to talk you through healthcare issues, or even meet with a provider and call in medicine if you're really sick on the weekend and need something. Behavioral health, we have a big behavioral health program, so we have a nurse practitioner who can do medication management, we have therapists who provide counseling for the employees. If there is an on-site incident, so every now and then there will be an employee death or something that will happen and you need on-site behavioral health support, we can send somebody to the location and just be available for the employees.
You do the wellness plan too.
Yeah.
That's a big call.
I have a question about the X-ray, issue. Is Ellis, is that it? Did you say
Ellis
Ellis?
has it.
So, you have an X-ray machine there? Okay. So, my background is family practice, and I've done urgent care and all that. How are you managing the X-ray component of that? Do you have a lead line room? Do you have Are the employees wearing the badges and licensure through the state and all that?
Absolutely.
Okay. I had a question about that.
So last year, when this board and the Board of Education approved the purchase of the X-ray machine, so it's not one-to-one, this is y'all. Nothing we have is ours, it's all county owned. Yes, the Board of Education Maintenance Department is the one that built all of the walls and the specifications, so they partnered with the X-ray company to build everything redlined and the windows and all the things, yeah.
Do you have a provider that, when they do the x-rays, is there another person that's reading those x-rays and they're getting reports? Radiology group? Okay.
How long is one-to-one, I think I've asked you this before, how long has one-to-one been our clinic of choice?
I believe we've been here 7 years, but the clinics have been existing for 13
Longer than that. He was here when I got here in '09.
Okay, perfect. The clinics have been around a long time, but we've been here 7 years.
And our contract with one-to-one, is it a 5-year, or what is our term?
I think it is a 5-year, and it was renewed either last year or the year before.
I'd have to look, we got them on file, but.
Yeah.
So it's for all county employees and school board? Or
It's a shared contract.
shared contract? Okay.
So they have a contract with us, and you guys have a contract with us.
All county employees that are on the health insurance.
Correct.
It's part of your health insurance benefits.
In
You
every
got health insurance.
That's right, eligible.
You got it, and eligible, so you gotta provide your health card to them, or your spouse, or your dependents, if they're on the plan.
You verify eligibility.
So, one of the questions that we had today was regarding the one-to-one equipment. I know that you said that the county owns it, but we share, we have non-school county and we have school county, and you know how we're in partnership with this. And so we just want to make sure that we have insurance coverage on everything. So our question is, that we wanted to bring to the table was to discuss the one-to-one equipment and who's insuring it. Are we insuring it? Fine.
No. Oh, I'm sorry.
Yes, Ms. White.
The insurance is through the school board, we pay an allocation. Now, this is the one thing I'm unclear on. Our percentage, whether it's based on total number of employees or total number of covered employees. But I believe we were at about the 16% threshold of cost allocated. The X-ray machine is currently being covered and will be incorporated with coverage of all the equipment effective July 1, is my understanding. But since it's such a big ticket item, they went ahead and got coverage on the X-ray
Good.
machine.
Excellent. Regarding whether, our shared agreement between the county and the school,
I have no idea.
I mean, that's in one-to-one in the school, yeah.
between what our percentage
Some
coverage is.
are actual costs, and some of that percentage are based on number of participants, so yeah, it's spelled out in the agreement.
And then-
Some things are actual costs that goes through, and some are based on that percentage if it's a shared cost.
So it's in our one-to-one contract, and it says schools will pay this amount and we'll pay this amount.
I think it's, I would have to look, I think it's just got a percentage in it.
It's a percentage, yeah, it's like a.
But one-to-one's not obtaining the insurance coverage, that's on us,
Right, that's.
or the school board.
Right, it'd be one of those flow through, or it'd be a direct by the school.
So if you could just resolve your answer to whether it's based on the number of employees are covered to your satisfaction.
So does the school.
No, I was just bringing it up for you all, it doesn't matter to me. Y'all are the ones that decide how you want the allocation to be. I'm just letting you know, I'm not sure, when I mentioned your question, whether it's covered or total.
I would think it would be a rich contract, like almost an interlocal.
And apparently, that's what David's saying, is the agreement on the insurance, they've allocated it being a percentage of on coverage.
Some things are actual cost, and it's spelled out in the agreement, and some things are that allocation. You know, some things aren't divisible based on usage as easily. So it's just spelled out one way or the other. And just like right now, my understanding is Dr. Langford has bought the insurance, is gonna send me a bill, so I just wanna make the committee aware. When I do receive the bill, we'll pay our 16% through your trust fund here directly.
He told me that the X-ray machine was gonna be insured effective the 16th of April last month. And, then everything else would fall in line, and I quoted him the 84-16% ratios. He didn't quibble with that. He said that he would make sure that they've got the, bill when it arrives. them also tell them why,
How,
make
how
sure.
does the X-ray equipment move out of self-insurance? Do we have an insurance bill?
Because it's not in our building.
So we have a separate policy
Well,
that the school maintains?
It's a shared equipment and it's not in our building, so we insure
Are they?
our building and
self-insuring?
contact, well, we're self-insured, so our building contents have an amount in them, well, that's not our building, so it wouldn't be in one of those content totals. So if that school, say that roof collapsed, that's not our insured building, so it's not the content amount where we're self-insured or, for our reinsurance, or we didn't get anything.
So is the school running it under their self-insurance?
I don't know if they're self-insured, but it's being covered.
It's under their insurance, whatever it is.
Whatever that is. That's all the questions I have.
But unless you guys object, when Dr. Langford sends the bill, since it'll probably be paid directly to Carrie, he sends me a bill, I'll pay her agreed upon percentage back to the school, so, because they're probably gonna pay the bill. We'll file the insurance with the bill, so.
So without objections, we'll go back into session. Thank you, ladies, for your time. Anybody else? No? Thank you.
You don't need us to say, right?
I do not believe.
No, you won't be part of the press office, you won't. Okay.
So,
You gonna vote on giving him authority to cut that check?
Dr. Langford, based upon our agreed upon. If he sends me a copy of the insurance, I'm sending the 16%, because I'm sure he don't have to pay the bill himself.
yes, can I get a motion
So that motion.
to pay to pay the Board of Education?
For the insurance on the X-ray machine.
Second.
I'll second.
All in favor?
Aye.
Passes. So I'd like to go to, the report of the ATTL analysis.
Yeah.
And we'll be moving the executive session till after, to give them free time.
And she had a really good question. A lot of these says sample and recommend.
Yes, I was gonna go through each thing and then talk about what I.
How are we gonna get those back to Blue Cross? Can we send those, or have you guys?
I will send a very organized Excel, this is what it says, this is what we want it to say.
Because it said in their thing that they could do it for us, but I thought we wasn't planning to do that.
I was
We thought
worried
you were
about
gonna.
that.
Yeah, no, no.
Yeah, that's a question. I didn't even
No.
think about it.
Things get lost in translation when you've got a bunch of people with their hands trying to get things fixed. And so I think that whatever we decide today, it would make more sense for me to just, to go back, because usually the way I understand it, the evidence of coverage writers really is it's without legal, really, that does the EOC writing, right? They really write it. Or do you have plans like EOC writers?
What's the legal part?
It is the legal part. Okay, it is the legal part. So they're writing this. So basically what I think would make the most sense is to say, page number, this is what it says, this is what we want it to say. And so this is all going to be based on the analysis you all had done. You've had 2 different analyses done. Did you want to?
Yes, for their benefit, because that's
Yes.
not here. Can you tell them how we got to this
Yes.
point, and how we,
Yeah, I wanted to do that anyway, because you all got this huge thing that Jessica couldn't even send because it was so big. So she had to send a link of, which was all those insurance policies, but there were also, a lot of it was my fault. So, on page 83, you're going to see something that looks like this. Yes, and it goes all the way to page 99, or 100, what have you. So there's this. This is actually an EOC assessment. So EOC means evidence of coverage. All right, this is Blue Cross's document that shows what's covered. You heard it referenced today in discussion. Someone said, but it's not an EOC. Oh, hey.
I just wanted to clarify, it's actually Sumner County.
Sumner County's EOC, that's right. Sumner County's EOC, because you guys can kind of do anything you want to it, but they will fight us on some of it, but mostly you can do whatever you want to it, okay? So there we go. So it's our EOC. You are self-funded. You really are in control, okay? That is one of the reasons you're self-funded. So this is the PHIA group, PHIA, all right? They're a legal group that just does benefits. That's really what their main purpose is. They have also teamed up with another group I'm going to reference later, which is NVQ Consulting. the analysis, this is one of the things you paid to have done. And this is has many more findings than the NQTL analysis, all right? So I actually use this as kind of my basis for all the recommendations I'll make later. Okay, so that's the first little section of things that we had done. And the reason we have this done is because you all have had this EOC for years, and you've made changes to it, bits and pieces. You've heard some of the things today that were recommended. That's a little change. Things keep kind of slowly getting changed, and then we end up 20 years later, oh, we need to look at that. Okay, so the next little piece is the next section in the same big old chunk of things, page 100, all the way to 180, no, yeah, 183, I think. And that is the actual NQTL analysis. That is an analysis that is required. It came about initially in the Consolidated Appropriations Act, which was something that was passed during COVID. And people didn't realize it actually had anything to do with benefits because they were just thinking about COVID stuff. And, well, it doesn't seem like it applies, but it does. So it goes hand in hand with mental health parity. Layman's terms, if you cover it for mental health, you've got to cover it for physical health, all right? So if you're going to say you can only have 7 mental health visits, you're going to have to say you can only have 7 physical health visits, all right? That's what parity is. It gets that in the weeds. That's an easy way to kind of look at parity, right? A number, 7 is 7. That's equal. That's easy. This analysis looks more at things that you might not have so much control over. So if I were to go to a mental health hospital or need to go, that's controlled by a network that you pay Blue Cross to manage. And whether or not that gets through prior authorization or any of that stuff that maybe you haven't touched in the EOC, well, that's on their processes, that they have doctors and they have all these things that happen and what happens. So they have to help respond to this. Whether I need to have heart surgery, that goes through a different prior authorization process, right? So they looked at how many failures versus how many failures through the PA process, prior authorization process, were there. Those aren't necessarily quantitative. That's like process matching versus not. So that's really what the NQTL analysis is. In it, we do find quantitative issues. Some of the non-quantitative things you have zero control over, okay, because you pay someone to do it for you. But the ones that are quantitative and that are actually in your EOC, you have control over. And those are the ones we're going to talk about today. So we can get what we can control, we're going to control. Some of the other stuff is just going to happen. Now, what do I do with an NQTL analysis? We have to keep one up to date. Chances are the DOL, the Department of Labor, is not going to come to you. They're not going to come to Amy and say, give me your NQTL analysis. Most likely what would happen is that they would go to Chattanooga, to Blue Cross Blue Shield, and say, we are auditing this many of your plans. Because we've had a complaint from a doctor who said that Blue Cross doesn't pay out as well for physical or for mental health as they do physical health. And that sets off an audit. And this is what is happening. So the DOL is actually reporting to Congress every year on their findings. You can Google machine, you can read all you want later, okay? There are findings, they summarize them, you can see the findings that they have, that they found. They are auditing. It is a real thing. You do not make this up. So, different health plans have been hit. It seems, I think I'm finding that unions are getting hit more first, but they're continuing to audit. So, you have to be ready, though. If they come and ask for an audit, you need to have the analysis ready to go. So you have one now, and that has been provided. You all have a copy of it, so you will be able to check that off. And so there are a few things we need to change. Now, beyond that is Brittany's document, the one I created that is super long, and that's what we're going to go through today. But it actually coincides with that first section that I said that was just your plan analysis. So, there's also, I just wanted you all to have everything. So I asked Blue Cross to send me, what is your current evidence of coverage look like? Because we use the Sumner County one that's changed a million times. And I'd like to see what your current Tennessee one does, because we haven't gone back to their standard in years. ACA has passed. That's old. Like, people forget, that's old. So now that we talk about it, that's so old. So we've gone through a lot since then. So they provided the current sample. The other good piece is your ERISA exempt, which means you sometimes need to go back to what Tennessee's benchmark plan does, and so it plays into hearing aids. We'll talk about that in a little bit. But so we have to sometimes look at Tennessee's plan, which Blue Cross of Tennessee's plan does encompass. So it's really good to have their standard document. So that's kind of all the stuff that I was going through over a couple of months. So I'm going to go through the list. Do you have questions on that? That was a lot. We're not done. I'm going to go line by line. I really am, because what I have is a list of suggestions that I really would like for y'all to change. Now, if you want to follow along with where in the world is she coming up with this stuff, go back to that page 83, and actually you can skip on over to page 86. And I will tell you, there are things that they suggest that I'm just going to say, yeah, we don't need to do that, that's fine. And I did write down, we will need, just based on the conversation today, don't move that too far because I'll need it. Based on the conversation today, I'm going to need to double check. I did find an eligibility. You all have used ages, where you talk about retirement, where you talk about Medicare. And we need to get rid of ages. It needs to just say Medicare eligible. So that's not in this list, but I've already added something else. All right, so I have just commented on each thing because some people are very thorough and they would call me and say, why didn't you talk about this finding number 1 where they talk about a document type? I'm not going to read every little thing that they have said here. I just want to tell you that SIA said, hey, this is called an evidence of coverage. You don't have a plan document. They want to see something called a plan document. Blue Cross says, we don't do a plan document. Don't call it a plan document because it's not a plan document. It's not, okay? But you're ERISA exempt, which means that you legally don't necessarily have to have a plan document. The evidence of coverage does actually cover most of what a plan document would cover. All right? You all do include most of everything that would be in a plan document. You just can't call it the plan document because they don't want to call it that. I've looked at other Blue Cross clients in Tennessee. You can find them all online, state, county governments, whatever. What they've done is change this nice little thing on the evidence of coverage, and it just says plan document of city of insert name. And it's the same document you all have. So I just want to assure you, even though SIA says it seems like you're missing something, you're really not, okay? So we can move on. Now, the second part, so this talks about funding, okay? So the next piece is funding. So it just talks about, hey, you guys don't talk about this being an actual self-funded plan. And you don't. You actually really don't in your plan document, or in your evidence of coverage. You don't really ever say this is self-funded. Well, that is probably worth saying. I think it's worth pointing out. It talks about that is important. So one thing that you could do is just in your first paragraph. So if you want, in that big old chunk of documents, this is your evidence of coverage. I just have one of them. There are actually 2 evidences of coverage, not the sample one. It's going to be here. Do you know what page it is, Amy? In that big chunk that Jessica sent. Do y'all have it?
It's in there.
It looks like this, and it actually has a name on it.
It is on page 3.
Page 3.
So it's on page 3.
Not that, not page 3.
Is that the sample?
Keep going.
Is there actual one?
Check 194.
Did you say 194?
Page 194.
Go to 194.
Looks just like that.
Or 195.
It looks the same because y'all haven't changed a whole lot. That's
Yeah,
fine.
it's very similar.
Yeah.
Yeah, 195.
Yeah.
I just brought my book.
And option 1 and 2 is almost exactly the same.
And, yeah, what we make changes here, we're really gonna wanna make to both of the evidences of coverage, because they're really the same document. They're very, very similar. The only difference is wellness plan versus no wellness plan. Okay, so the very first, paragraph here in this, I just say that you all, in their sample document, they have a paragraph, that I think that we should actually use. So in their sample, and this is where it's gonna start getting messy, guys, I do apologize, but there is not really a pretty way to do this. So if you do look at their sample document, in their introduction, they actually just have this big paragraph. And it's literally an introduction paragraph, but it is much more comprehensive than what you guys have as your introduction.
Which page is that?
11. Okay.
Can I ask you, is this the book that we hand to the employees?
Yes.
Correct?
Yes,
It's
it is.
online too.
This is what the employees are gonna see. Yeah, and it's online. It is online. And actually, I think that, what we could do is to actually add the word self-funded to this, what we see in the standard in their document. We could actually add the word self-funded to that new paragraph. So it would read, this evidence of coverage of health coverage, this EOC was created for the employer, listed on the cover of the EOC, as part of its self-funded employee welfare benefit plan, the plan. I just think if we hit them at the front, this is self-funded. By saying and stating that it is self-funded, it means you are in control, you, the trust, is in control, it is self-funded. Meaning that Blue Cross does not really make the final decision, it's the county, the trust. You all are making these decisions. That's why I suggested that. Is that, I don't know the appropriate way to make these suggestions.
If I may just interject, if we could just have a quick discussion on how we would like to go ahead with this. Brittany's gonna have several suggestions. I'd like to, propose, put it out there to the group, that we can object if we do not agree at the time, or we could vote every time. What would the committee like?
Terry, can I mention one?
Yes, sir.
We've worked on things similar before. We made EOC changes, and what happened in the past, often they had Brittany, me, and the attorney work on the actual thing and bring it back. That's why I recommended we have this group look at it and ask Brittany, so you guys can kind of blame me for part of this.
Okay.
Because I had a concern because we didn't make the changes together, but what they did in the past was just took the recommendations unless it changed the benefit for an employee, because most of this you're going to see things like self-funding, or if it's for the quantitative analysis, you paid a group to do something that took a long time, you're really not going to want to go against it. So I think for you guys' sake of time and efficiency, we'd only to have, basically take her recommendation as is and have her just to go through the ones that would actually change a benefit for an employee at all. Because I don't think you really care if it says self-funded in the plan.
No, that's a legal
Unless you want to
issue.
spend several hours in here, how long is it going to take?
I'm fine, you're not gonna hurt my feelings.
How many hours is it going to take you just to read through it?
It's gonna be a while.
So my thought is, would you guys be objectionable just having her, basically, if it does not change the benefit, to take her recommendations, because you've had them online where you can look at them, and just have her to go over the ones that could potentially change any employee's benefits, which are going to be very, very few. Probably going to bring you down to what, less than an hour?
Oh, yeah.
Maybe
Most of it's
forward
gonna be me
one.
trying to figure out what actually changes their benefits, because I actually don't,
Unless you guys want to be here.
none of them are gonna take, we're not taking anything.
So it's going to make a big difference on your time.
A lot of it is going to be a suggestion that we need to follow what Blue Cross's standard is, because there has been a lot of legislative changes, and there have been updates to wording. So DSM, which is the manual that we use for mental health diagnoses, there have been new definitions added. We need to change some wording, the words that are used, things like that. That's mostly what a lot of it is. Like the next suggestion is in the Blue Cross thing, the benefit administration error. That's kind of an important paragraph, and y'all don't have anything about it. I think that we need to have that, because that's if there's an accident. Everybody makes accidents. Like, what do we do in those instances? necessarily a good thing, which we've had someone bring something today when we were silent. What happened? You all have to talk about it, and that's not good. So I can look through here
Just like the discussion.
and see if there's anything that actually changes the benefit. But most of it is going to really be following what Blue Cross's legal really says is in their evidence of coverage, because this is their standard. So we can go, Sumner would just match closer to what their EOC says.
So it's a form versus function.
It really is. It really is.
Some of us would tell what
Because time.
document supersedes the other ones too.
Mhm.
Like you earlier, just like you're talking about the minutes superseding the EOC, there's probably some language in here that supersedes everything else, which would have kind of dealt with this issue that we're
But in follow-up to this meeting, you'll be reviewing it for the legal.
Right.
With legal and with finance.
Right, so what usually happens when we have EOC changes, and they already will have a change coming out after, it never happens right at July 1, because you have a new plan year happening July 1. So August or September, we'll have a new EOC coming out. It'll be red line. Any changes happen, just because of wording changes, what have you. So legal will send us that. We'll look through that and agree or not agree with changes. And so what would be incorporated at that time is any of these changes. And then we would see that. So there's going to be a red line, which
Just
is
to be
beautiful.
clear, she's talking about their legal.
Yes, they're legal.
In the past, they considered, like in the past, what they've done many years ago, on administrative meetings, they had the county attorney and the finance director deal with administrative stuff, such as like ordering vaccines in the clinic or something during the month, all that stuff's done internally versus the board. And then working on these plans was always done internally unless it changed an employee benefit. Because the board, the same thing, don't want to be here for 4 or 5 hours, because last time we worked on some changes, not this and that, between Brittany, me, the county attorney, and some of my staff, we probably spent a good 8 hours.
Yeah.
So you got, so there's some time here you're about to spend. And I don't know, I'm guessing, I don't know Brittany's, but I'm guessing it's going to take you 4 hours to really get
It might. I'm not, I mean, it could. I would hope maybe 2,
So,
but it's still a long time.
Just to be clear, are we tabling that as a motion that she just cut to the change in benefits, or?
So what is the will of the committee?
Honestly, if it's just that kind of a change, then I think that's the bottom line as to what somebody's looking for, if it does change their coverage. And, that's what we probably need to address. That's the only thing.
Well, not to speak out of turn, but I will. That's what we're paying them for anyway.
Yeah, I know.
So,
That's what it's
And this other group too, you've hired another complete group to listen to it too. Plus, Brittany does a lot more of this than any of us. Regularly. Now, I do some, but not to this extent, and,
Okay,
if you don't change the benefits, you probably don't want to rewrite the wheel, rewrite the wheel.
No,
Make a new wheel.
exactly.
So I make a motion that we listen to Brittany on all items concerning benefit changes.
Mostly you might have questions. Yes.
we need to vote on that.
Oh, what's that?
I'll second your motion.
Thank you. All in favor?
Okay, so really on changes, for essential health benefits, that's an ACA term, so those are called EHBs. I had mentioned hearing aids earlier. Do we know why the age provided in the EOC is those over 19 instead of just saying over 18? Do we have any idea why it says that?
There was some other verbiage that said over 19 years ago, and I'm assuming at one point that was a requirement, and it changed, it was to do, I think it was even in our dental coverage,
Well,
19 braces too.
So the
I don't think that's applicable anymore.
Okay, well, the Tennessee essential health benefit is what we need to follow, and I'm almost certain that I can double check okay, we're just going to follow the Tennessee essential health benefit. I believe that it should say over 18 on hearing aids, so it's just a change of the age. I just didn't know why it was including.
So that you're saying that if you're under 18, you don't qualify for hearing aids?
You all actually, I think, cover hearing aids, a little differently.
We cover it differently because we had an employee come and ask us to cover it one time, they got out of it. I was at the meeting.
You can't have children that.
Yeah, children, that's what I
Hard
say,
hearing.
children.
Yeah, there's, so there's a requirement to cover certain levels of hearing aids. Hold on.
If I remember, Brittany, it was an employee that came to ask to be covered. We already covered everybody 18 and under, so I think that's where the 19 came from. Since you said that, it's covered 19 and over because 18 and under was already covered. And I believe that's where that came from. But I could
This
be
is an
wrong.
odd age to
Well,
point out.
Well, what I think is I think everybody
EOC.
18 and under was covered already, so they put 19 and over covered everybody with that provision.
Opposed to saying over 18,
Mm-hmm.
they said 19 and above.
Because everybody 18 and under was covered the other way.
Say everybody.
That's what I kind of recall because I remember there was a discussion. We didn't used to cover people over
So
18.
yeah, you have, so it says hearing aids for anyone age 19 and over. And then it says hearing aids for members under age 18.
So what if you're
It actually seems like people who are 18 years old just aren't covered. That's what, it kind of seems like there's a gap for 18-year-olds, the way that it's worded.
Right.
So that's why I'm saying it should say 18 and up, not, yeah.
That's why I asked for this to be.
Okay, yes, that's what it is.
Is the coverage different between the two?
Yes, the essential health benefit is, so anyone who's 18 and over is limited to $6,000 every 5 years, including ear multi-services to select, fit, and adjust the hearing aids. That is I'm pretty sure that follows the Tennessee Essential, the benchmark plan. And then hearing aids for members under age 18 is limited to 1 per ear every 3 years, including the same types of things. I think that's also because of growth.
Right.
Because
Growth.
growth
So we
change.
need to keep that age.
Yeah, but it needs to, this needs to be 18, not
Right.
anyone aged 19 and older. It should be 18 and older. Okay.
So can I ask you, when we originally came up with all of our coverage, is this just standard coverage?
It started standard.
And then we just like
Yeah.
tweak.
Hey, they're requesting a break. Is it this one?
Okay. Without objections, we'll take a 5-minute break. All in favor?
Aye.
Yes.
Can you stop that one?
I'll make
Let me answer a question real quick too. All right.
You really wanna know what I think? I'll tell you.
We turned it off.
No, we turned it off. Is it on? No, it's gonna hit start.
All right, so, we reconvene after our, short break. Are we on?
It's on. It's on. Does it say stop now, don't it? Yeah.
Did you think?
It wasn't on earlier, was it?
I don't know.
I think it must have been. I don't think so. I don't think it.
Oh.
No, you started stuff.
Okay, all right, let's do this. I think this will be pretty quick, because most of this is just gonna be, I want you to mostly just be aware of some things that we have to do just per legislative requirements, but it does change. The financial impact of the plan shouldn't be significant, but I just want you to always be aware of what could happen. So one of them we have discussed informally before, but let's just make that formal. So there is an eligible children requirement. I've discussed this before, and I do believe that it's been treated this way, but we will make it formal in the EOC from here on. So right now, the EOCs say there's a financial requirement for stepchildren to be considered eligible dependents. That will go away. There is no financial requirement allowed for ACA. That's been in place for a very long time. So we will be removing the financial requirement so that you're in play with ACA.
We've been administering it that way anyway.
It's been administered that way, so we're just going to get that in line with practice, so that we are doing things the correct way. Okay. Another thing to note, okay, right now on the EOC, there is so you have a family out-of-pocket maximum. That is on most plans. So there's a definition on page 59 of that plan, the EOC, and it says this maximum can be satisfied by a combination of services provided by network and out-of-network providers. And there's a clause that says, except outpatient psychiatric services. That clause has to go away. Okay, so that's not really an ask unless you want to remain out of compliance with law. So we're gonna take that out. I do want to get your approval on how you want to handle this. My inclination is that if I were in your shoes, I would not want to be making these decisions. I would want this actually to remain as is. But under investigational services, so FIA in their assessment says that the county, they're saying that you should add that the plan administrator has the discretionary authority to make determinations as to which drugs, services, supplies, care, and or treatment shall be considered investigational. I would not want to make that determination at any point. You pay for Blue Cross to do that. Their point is you're self-funded, you get to make the final call. I would never want to make that call. That's why I don't, because I don't live or work here, but I would not, I pay Blue Cross to do that. I'm not a doctor. I do not determine what is investigational. So would you want to be the final call in what is considered investigational? Or would you want to leave that in Blue Cross's hands?
So if you leave it alone, then it's up to Blue Cross to determine it. If you say we will determine that, then you put yourself in as a medical provider.
I mean, to me, that is how that looks.
I don't think
legally, that's how that would look, right?
I've got a problem with having the ability to control anything in a patient's
exactly.
purview. So.
And it gets a little gray in a self-funded plan because you do get to make decisions. You can override plans. So I'm going to leave this in Blue Cross.
Well, even if that was it's the intent to say, well, you're probably going to follow Blue Cross Blue Shield anyway, but because you're self-funded, you're the ultimate authority.
That's probably the intention.
Yeah, but I still don't like it.
Okay, I don't either. But I
was just wondering where they were coming from.
I think that's the intention, that you do still have the final say, but you would follow what they want to say.
That's my advice.
I just want clarification for myself. Investigational, is that experimental?
Yes.
And how does our coverage cover experimental?
That's typically not covered.
It's not covered. I just want to understand.
It follows the law of ACA. There may be some things that are covered investigational. As you know, there's always a determination between emergency use approval. That's not investigational, but then there's investigational So if you're in a clinical trial, typically that stuff is not covered. I could be quoting that law incorrectly because I'm doing this off the top of my head. But I don't believe that it's typically covered.
In a clinical trial, since I've been through this, don't the pharmaceutical or they pay for all the testing
Usually.
and all that, and then the doctors are reimbursed through the pharmaceutical company?
Usually that's the way it works. That was what I did before all of this, so, yeah.
Just clear up, our plan doesn't cover it.
Right.
Yes, thank you.
Are you fine to leave that?
Yes,
Okay.
oh, I'm fine.
Okay.
I just want to understand.
Okay. And actually, most everything else has to do with adding definitions of things because a lot of things are just silent. And so we just want to add in, what does it mean to, there are some new definitions because of Consolidated Appropriations Act, and the no balance bill laws. You might have heard no balance billing, that kind of thing. So there's a lot of new acronyms because insurance needed a few more. And so we're defining those in your plan document or in the evidence of coverage now. So things like a qualifying payment amount, a recognized amount, that kind of thing. I told you there was a change of definition from a substance abuse. It's called substance use disorder now. So we're just changing that wording. So it's because of the DSM update. So we just follow the medical. That's a medical check. So yeah. I do want to just clarify, these are really the last things. These are notices. My inclination is to include notices. These are the notices. I'll just sum them up. So there's the Women's Health and Cancer Rights Act. There's the Mental Health Parity and Addiction Equity Act, which is mental health parity we've been talking about. There's HIPAA. And then there's GINA, the Genetic Information Non-Discrimination Act. Those are all acts that most of them are referenced at some point, some are touched on, some acronyms are used, but they might not be defined in your evidence of coverage. To me, the easiest thing to do is to just put the notice in your document at the end. Are you fine to do that? These are not often updated. They are very basic. I actually included them in my,
Is there not like a definition section?
There is a definition section. We can do that. I mean, this is an example of what GINA is. It's like a one-pager. The women's health, that one is very short. This is mental health parity. That's how short that is. So we can include it in definitions. Yeah, you reference and you follow the law for the cancer rights, so you're supposed to cover mastectomy, reconstruction, and I do believe wig is part of that if you have chemotherapy. So, but you don't list the actual act. It just makes sense to list the full act, I think. Just, why not? And so, do you think we should just add it in the definitions?
We're using acronyms now that aren't defined.
Yes, I believe so, off the top of my head.
Yeah, to me, that's a legal problem. The other thing is I go straight to the definition section, so my suggestion is get it with definitions, and wherever you want definitions to be on the front or the end, then that's where you put it.
Do you
With
have,
the definitions, I'm sorry.
do you have in the act itself, do you have a, when you're doing that, is there a way for a person to go to a link and look at it, give in that information, or are they just relying on what you've written?
You know, because this is a PDF, we could add one. I can't remember if this EOC includes for the preventive covered services, if we just use a link, because that changes all the time.
Right.
They're changing what's covered for preventive services. Sometimes, so a lot of people don't like to list all those things because those recommendations are changing. So we can add a link. I don't think it's in there now.
I think it's a good,
but
people are very computer savvy now.
Right.
They pull things offline, so.
I don't recommend that from a legal standpoint because it does require some upkeep, maintenance, and making sure that these links are still active. And additionally, you're going to start getting feedback about why doesn't this have a link, or they can copy, paste, get it in a search engine and find whatever they want. Leave that work on them. We've provided them what we need to. let's not start giving them expectations of more than what we're required to do. That's my suggestion.
Are these part of annual notices, though? Do we provide annual notices of any sort, or keep a link
This
of,
is the one thing for there's one you say every year.
there's always the Medicare one.
The Medicare one, I think.
But that's what I'm saying, if we're required to give annual notices or disclosures, will the definitions do that, or can we put the annual in the back of the book?
Most people don't put them in the back of this book. I have another client who is really like honing in on their, following all these rules and such, and they have included most of these as, an annual notice, and so they do just have their HR page, and it'll say, Women's Health and Cancer Rights Act, and then they'll have the Medicare notice, and they'll have.
Do we have to give an annual notice for any of them other than Medicare? I know the Medicare, but.
No, not necessarily. There are laws and rules about what is an annual notice, and I have a list of what's actually required to go out. But some people do include these, but these to me are related to health insurance. And so that's why these make sense to go here instead of just a notice someone would receive in the mail or what have you. So, and also because we do reference they're related to insurance, you reference the acronym and you use these terms, and so it all kind of applies to here. So, yeah, we can add them to the definitions, and that makes total sense, and it's logical. So,
Do you have an acronym page that just like this, the 3 letters, and this is what this means?
usually, it's like in the definitions, what it would say is it would say Genetic Information Non-Discrimination Act, and then in parentheses it'll say GINA, and then it'll say what it is.
Okay.
Or it'll list the act.
Okay.
That's all the words of the act. Okay, so, and that's it. Like, really, that's it. So everything else, we should, yeah, we really needed to take out the outpatient psychiatric clause. That was not right. And then what was the other one? I don't remember. That also touches that NQTL, that not matching the mental health and physical health, because that was treating mental health as something, as an other, which is when you can't do that. Yeah.
But overall, it sounds like
Overall,
we were.
it's good, yes. Some of these plan document findings that we got in that full assessment of the whole plan document, they really are because the EOC has just kind of been the same document. It's been slowly tweaked. And, you know, when Blue Cross sends the new document each plan year, I think at this point you all have veered so far from the standard, it was really hard for them to say, well, this doesn't match our current standard. So I think when we get some of these things back in line, they'll be able to communicate a little better. And also we can get it a little bit more under control now that we're at a good starting place, which I think is kind of the same with the other documents, the OJI. You know, once you do a really good look, it's a good starting place. Now, okay, now we can kind of keep doing small things.
That was my next question. Are we just gonna we anticipate that we'll just maintain this and not have to do a deep look again for a decade?
Right.
Too far away.
Maybe, I mean, you could do it maybe every 5 years, every 10 years. Like, I think that would probably be smart, just to stay on top of it so it's less. I think that's the only reason this is so much, because it's not been changed. I mean, you all have been self-funded since when?
I think he told us we called the plan document, we had it from 76.
So,
I think it's the same original document that we just been tweaked on.
it's a lot. So I am going to put it in an Excel document for Blue Cross. That was my intention. And, yeah, so it'll be very organized for them. Do you need to see anything to approve, or?
I think they've accommodated the approval part of this,
Okay.
so, if I can just get a copy of the polished product.
Okay, yes, use the red line.
Yeah, that'd be
Original,
nice, yes.
yeah, definitely, use the red line.
I wouldn't mind seeing a red line. I won't I'll read every page.
Okay.
And you don't get it. Go
Either take the quiz or you don't get it.
It's
And all of those things, you get the free thing, you can read the whole document.
That's right. I'll have a prize. I'll have tattoos, like temporary tattoos and stickers for all who read the entire red line document.
survived it.
Thank you for
You
that.
survived reading this, right?
Does this committee have any further questions of our consultants?
I don't have any.
Can I ask one more question? Yes.
Oh, yes,
Oh,
please.
sorry. Will you ask me for the summary for the minutes, or did someone have a specific question about the law?
It'd be nice to have something for the minutes.
Yes.
Okay, I sent her one.
asking, because I sent that email the other day asking her.
About the pharmacy law. So she had asked me if I could send a summary of the pharmacy law, that I had spoke about last time. So I do want to let you know that I have found another group. We may be able to do some things with pharmacy. I think we might be able to get around not get around, that sounds not
That doesn't sound
above
good.
table, yes.
There's a loophole.
I do apologize, it's not really a loophole, it's just a different contract type. This is it was working with a nonprofit group, actually, to do the pharmacy benefit management a little differently than what you're doing now. So, one thing I did want to ask, and this is not really on the agenda, it's not on the agenda though, so I don't know if we can do it. I just didn't know if I could get the approval to get a data request to just do an analysis.
I think
Data analysis on your pharmacy
Just a special call, regular.
with a different pharmacy group that I've
Just a regular
found.
call, wasn't it?
This meeting,
I think this is just a regular, it was
Yeah,
a
this
call
is not a
meeting, but it wasn't a
Yeah.
special call.
Right.
It's not special.
It was just a call meeting, but it wasn't a special call.
Because I have to get someone to sign off. If Blue Cross is going to deliver data, we have to do the sign, even though there's no member data, there's nobody's name, it doesn't say Brittany Spradling birth date, none of that information's on it, it just says medication names and costs and things like that, but in that file feed, Blue Cross will still require a signature from the county, which I think you might have signed before.
I usually sign it.
And to sign off on that data transfer. I just want to do a look to then see if it's even worth me bothering your time to see if we might want to RFP or PBM.
what specifically are you asking?
Unless you object, I'll just sign off.
Pharmacy data, drug costs.
Unless the committee objects, I'll just sign off on it. 'Cause I
On
always
our-
do.
And you need our permission to obtain that information?
I do.
Okay.
And I generally sign off on it
Will there
anyway.
be a cost?
No, I wouldn't do it.
Can I get a motion
Unless you guys object, I've always signed off in the past anyway.
without our approval?
Guys,
Oh.
sign off, yeah.
No, I've always gotten their approval.
Have we? I thought I
Yes,
signed
I've always gotten their approval.
Because I'm not gonna get
I make a motion.
Even I thought I should sign off on it. They're not looking for. Because they're not, they're HIPAA compliant.
No.
Yes, no patient data.
No patient.
No patient
And
data.
then,
I don't have, I
if you
believe
still
it.
have just a little bit of time to complete the game sometime.
Yeah.
We need to vote on this.
Well, that's what Mr. Lawrence just sent me out, and I'll just try that. So, can I have a motion, I have a motion from Commissioner Janung to allow Mr. Loy to sign off to Blue Cross to allow the data that has no employee-specific information for the consultants to review for our pharmacy analysis. Is that,
No, second.
all in favor?
Aye.
Aye. Mr. Loy, does that give you the approval you need?
Yeah, since it had no employee data.
He was gonna do it anyway.
Study it. I really think kind of a moot point, I think it was fine anyway, but we'll take it.
So actually, I have two questions. First, I'd like to ask you, we did talk about the one drug that the price is going up and stuff. And, do you have any new information? Is that our most expensive drug?
Yes.
So do y'all
Which drug
know what
was
we're?
I don't know the name of it off the top of my head. It's for a very, very, it's a disease you've heard of before. I don't know how much you want me to say since we're public here and it could be identified.
Yeah.
So I get a little cautious about that. But it is for a specific disease. This person has been on the plan for a while. This has happened for year over year over year. So,
I was more like looking for the one that we have a certain number of employees using the one drug.
okay, so we have, yes, we have had an increase, yes, we've had a great increase, in the usage of, I do believe Ozempic. I feel like there was an increase in another one of the GLP drugs. So Blue Cross Blue Shield does give us an annual report every year of pharmacy, of medical, all of those things. They did implement, a little bit more stricter protocol. Most PBMs have put in a more strict protocol, on prior authorization for utilizing GLP-1 medication. Let me be very clear, especially because this is public, that if someone needs it, they need to be able to get it. So if it is being used to treat diabetes, that is what those drugs, the majority of them, are approved for. And so if that is what works, typically put in place because something else doesn't work. There are typically other things you could use. There's other things that we could use. But we have seen billions in the United States alone in spending of just these medications.
It's off-label, being used off-label.
It absolutely is. And we have people who don't understand the ramifications, the side effects, the fact that when you go on it, you're on it. You can't just stop. And so there's a lot of things that are happening. We also don't have a ton of long-term data. And if you're not taking it through a program such as one at Vanderbilt, where they really do try to help you come off of that medication through lifestyle interventions, diet changes, exercise, all those types of things, it usually just ends right back where you were. And so you are spending money on that, and there was an increase in spending on that. And so that would be a drug of choice that most of my friends are really trying to hone in on. I don't believe, I can look back in the EOC, but I don't believe you cover weight loss programs, weight loss drugs, weight loss management as a covered service. I don't think that's actually in that EOC. As much as I've looked through it, I've just looked through your EOC so much that at this point, I think it just goes out.
I'm 100% sure it's not.
Most plans actually really don't. And so, but people are finding doctors to say that they are diabetic, but whatever they can get the doctor to sign off on, and so they are able to attain those drugs. And so that is an issue. That was a long answer for a question. I don't even know if I answered what you were asking. I'm sorry, but you have spent a lot of money on the medication.
We have spent a lot.
It is
one of our costs.
Yes. Yes. Yes, it is. It absolutely is. And so we're definitely looking at that. That will be something I would expect to see honed in on when we do the analysis.
So, it's over 100 people on our plan. Yes. And the costs are creeping up. So, and Brittany told me they're anticipating those costs will continue to.
Well, you're looking at probably too costs going up because the side effects of what will happen to them as they're on it for a long time, they're going to cause other health issues. So that's going to make it even more higher for your insurance.
Yes, it's going to affect our health.
Absolutely.
Long-term causes of medications is always a concern. With any new medication, it's always something you've got to keep an eye out. And when you're messing with your GI tract, sterilization of your GI tract is one that I've heard of that's a little scary. There's just different things that are out there. So, that data will continue to trickle in. The FDA is constantly getting information in on adverse events that happen with medications. So, yeah, we're still watching it.
It'll be interesting when you come back with the prescription.
Do you guys work with the one-on-one, what is it?
One-to-one
clinic about their prescribing practices or anything?
No, I mean, I'm not going to tell them definitely what to do or what not to do.
Okay.
I will work with them in that I communicate with them on what they might need to do. They also have one or two other than my clients, I think. So I just talk to them about some things. They have implemented, one of the things that she did not mention, is they also will do some mail order, which is at a lower cost than running it through your plan. Right. So the drugs running through your plan are super expensive compared to those that are coming through the clinic, because they're getting them at cost with no markup. And so that's why I will always be a fan of driving claims, which, whether it's a visit or a drug through the clinic, is going to be cheaper, a lot less cost. So.
I'm confused. You're saying they can pick up their prescriptions at the clinic?
It's only certain ones that can't be a controlled substance.
Yeah. Oh, yeah.
And we don't carry some name brands where it's a loss rate, but the ones where it is profitable for the county and not a controlled substance, then you can pick up at the clinic, and there's also a mail order section.
Yep.
But they don't do any kind of controlled substance.
Those have to be
Like the lottery?
I'm not sure what they have, but they have a formulary. You can absolutely, I think it's online right now.
We don't have
Not yet? Okay. Yeah, so you can totally check it out. See if it's good. But yeah, that's the way to get the medication.
To add one more element to what you're talking about, a lot of folks hear about name brand drugs and how expensive they are. That's really not your cost driver. Your cost driver is generics because there are so many of them and the markups on those. So the bulk of that it's harder really, right? It's harder to do something about the name brands because of patents and those things. But generics, it's kind of an open market to
Well, one of the things,
figure a better way.
so one of the ways that we were working, and one of the things that happened with legislation is that we were able to get a per pill contract. We have clients that had a per pill contract on generics. And so that was able to drive down a lot of the generic costs, and that was wonderful. But then with the legislation, PBMs did not want to play like that anymore because they weren't making their money anymore other ways, because they weren't allowed to do the things, pharmacy benefit managers. I apologize. Yes, thank you. Another acronym. I apologize. So they weren't able to make money other ways, so because of legislation. So now, this nonprofit that I have discovered, they have a direct contract, so they are able to get lower costs on brand name drugs because they are a nonprofit. There is a direct contract. So what we've discovered is there are all these little groups that come in and they say, we can save you so much money. And they have all these like layered contracts, and there's all this hidden money that you don't know about, and you think you're getting a great deal, but you're actually just putting money in other people's pockets left and right, and I'm not going to name anyone's names, it's public. So anyway, what we're looking at is possibly signing on to a contract, direct contract. Might not even change the PBM. So I don't know. That's why I want to do analysis before I waste your time. I just want to see what it looks like. I don't have anybody with them yet, but they are with lots of other counties and states, cities. So yeah. So that's what I want to look at. Because anything we can do would be good. Because at this point, you're kind of just doing whatever Blue Cross tells you to do.
Okay, thank you.
Yes, you're welcome.
Thank you for your time.
Absolutely.
I think that we'll dismiss you.
Okay,
If anybody has any objections.
they're probably ready for me to go. Thank you all.
Thank you.
Let me know if anything pops up with a question.
I know that we've jumped around on our agenda. We do. Thank you. We do still have the executive session left. I assume that we don't have, Ms. White, do we have any liabilities that we're reviewing today? They're not on the agenda. Are they in the executive only? All right. Thank you.
Did you bring any of those emails?
Are we gonna go into executive session now?
No, there was that one, but there were a couple I wanted. No, but there was a couple I wanted you to bring with us.
Did we have anything before the executive session started about the equipment?
No, about this executive session.